Hey guys, what's up? It's been a while since I've last posted. Now, some of you already know, I actually got top surgery exactly 2 months ago from today. And that's mostly why I've been out. I've just been balancing work, college, surgery. It's kind of been a lot, and I really needed to take a step away from YouTube. But I did want to give some general updates on recovery, transition, bottom surgery, whatnot, and that is what this video is about. And just as a warning, I do have both pre-op and post-op pictures in this video. I'll add a trigger or content warning before all photos, but if seeing drains or someone's chest is something that might bother you, I wouldn't recommend watching the rest of this video. Now, just to preface, I actually got my first top surgery back in 2023, and I got a form called periareolar, which, to oversimplify things a bit, is when a circular incision is made around the areola, and then tissue is sort of taken out from that incision. Now, usually it's reserved for people with smaller chests and good elasticity, so I was kind of lucky to qualify for this surgery. The main reason why I chose peri over double incision, of course, was because it minimized the need for larger incisions or scars. I am a Pakistani man, I'm around brown people a lot of the time, and I just really felt like it was not safe for me to have scars from a double incision as opposed to something from peri. And I would say I was quite satisfied with the surgical technique, it's just the only issue was that there was not enough tissue taken out. As you can see from this photo, which is nearly 2 years post-op, it does sort of look like I have A cups. And around 2 years post-op, this isn't swelling anymore, so I had to go in and get them removed. And it actually took me around 2 years itself to get the surgery approved with insurance. It was basically a complete redo, right? Bilateral mastectomy, both sides, drains of course. Peri always requires drains as far as I'm aware. Now the surgery was outpatient, so I went in, signed some forms, spoke with the surgeon, the anesthesiologist, was strapped to the table, and woke up in the recovery room. Simple as that. Now, of course, after top surgery, I had to wear a binder 24/7 for the first month at least. As you can see under the binder, I was also wearing an ace wrap, and I had some gauze underneath the drains to relieve some of the discomfort there. In terms of showering, I could shower 48 hours after surgery, just had to make sure no scrubbing on the incisions, and that the water was running down super gently. For the drains, I had the left side removed 1 week post-op, and the right side removed 3 weeks post-op, and the reason why is because I had some complications. This is me one day after surgery. As you can see, I developed a lot of bruising. This actually was a hematoma. I guess my blood was just clotting a lot. How this came to be, I don't really know. I do remember the day of surgery, I was having these syncope episodes. I straight up passed out a couple times after surgery. I distinctly remember laying down in the evening, logging onto a Zoom meeting, and I just felt really sick, like I was going to throw up, super nauseous. So I got up to get a vomit bag, got up to sit down in a chair, and next thing I know, I woke up on the floor. So I must have passed out. And I'm still in this Zoom meeting with my lab, right? So, I get to my chair and I pass out again and wake up with my head on the desk. So, who knows, maybe when I passed out and fell on my chest, maybe that damaged something, or maybe the hematoma had nothing to do with that at all. Of course, I sort of panicked, called my surgeon at ungodly hours, which I feel terrible about. She agreed it was a hematoma. We decided to wait for it to liquefy and come out of the drains. And we were waiting till around 2 weeks post-op before considering surgery to remove the hematoma. And I have to be honest, those 2 weeks were just torture, mainly because of the drains. Around 1 week post-op, the drain on my left side was removed, which was really nice. I was actually really scared for it to come out because during my first top surgery, I was told it wasn't going to be painful, and then it was painful. The second time around, I didn't feel anything. The drain on the right side had in for an extra 2 weeks, and it was just torture. It was chafing, there was blood leaking everywhere. I would wake up and my pillows or bed sheets would have blood all over them. It was a whole thing, and I was just kind of miserable. So when I went to my 2 week post-op, I, told my surgeon that I regretted not asking for surgery to remove the hematoma. And she offered to evacuate the hematoma in the office then and there. We did try aspirating first, which is when they sort of stick a huge needle in your chest and sort of try and suck the blood out. But it just really was not working. My blood was too clotted. We had to do the washout. Now, this was not under general anesthesia. My surgeon did inject some sort of numbing agent. I'm guessing it was probably lidocaine. So I couldn't really feel anything. I was awake the whole time, just couldn't see what was going on. I could feel a strange pressure, like this feeling that someone stuck their finger in my chest and was just moving it around. It was really strange. But eventually got through that, went home, crashed for the night, and I'm getting ready to sleep, and then I hear a pop, and I look down and realize that my drain is broken. Somehow it just snapped right off the tube. So that was another late night phone call to my surgeon. Thankfully, it was pretty easy to get sorted out. I just had to snap it back in place. Now, the next day, I was put on antibiotics, but unfortunately, my incision started opening, and my nipple was beginning to develop some partial necrosis. There was a lot of redness and hotness to the touch. I may have had an infection. Why this happened, I have no idea, but after I took the antibiotics, things got a lot better. The redness went away pretty much immediately, and it took maybe a month for that wound separation to heal. Right, so that was a lot. That's pretty much all of the complications that I've had this time around. A lot more compared to last time, which I didn't really have any complications at all. I don't really want to take my shirt off at the moment, but this is what I look like now. Obviously, this is in good lighting. Usually, I look like a sack of potatoes, but I am pretty happy with the result. As you can see, one of my nipples is kind of lacking in pigmentation, and it's sort of healed into the scar, so I may end up asking my surgeon if that can be revised. And I'm not really sure how I'm feeling about the size of my areolas. Sometimes I feel fine, sometimes I feel a little dysphoric. I think I would probably prefer them to be smaller, but at the same time, it's not a huge issue. So I don't know, maybe I'll think about that and consider asking my surgeon for a revision around that as well. Another thing that you might notice is that there's this circular sort of shape to my right side. I think this is either bruising or one of my ribs. I can't really tell which. About the rib, my surgeon had mentioned that I guess one of my ribs sits higher or sticks out more. So unfortunately, my right side is always just going to jut out a little more than my left. I had a different surgeon tell me that it was a mild case of scoliosis, but my PCP didn't seem to agree, so I really have no idea what's going on there. Now I'm 8 weeks post op, I've gone back to working out, I've gone back to weightlifting, fencing, sports. I do notice that I have some residual tightness in my right side when I'm doing dead hangs or lat pull downs. Again, that is the side with the hematoma, so I guess that makes more sense. My sensation has begun coming back. I feel a lot of buzzing, prickling, so my nerves are probably waking up. And I'm feeling pretty optimistic that I'll have full sensation in my chest. After my first op surgery, I had full sensation. I was, of course, warned that I may lose that sensation after this surgery. Right now, I would say my sensation is probably a 6 or a 7 out of 10. So I would say it's pretty good already. Some people say that peri is a lot easier to recover from compared to double incision. I do think that my first op surgery was incredibly easy to recover from. It was probably the easiest surgery that I've had out of all 6 surgeries I've had. And I had full mobility basically after the first day. I could do a majority of things on my own. The second was definitely a lot harder with all the complications, but compared to friends who had double incision, I definitely feel like I had an easier recovery in the sense that I could do a lot of things on my own. For example, one of my friends had double incision with free nipple grafts, and they needed help with things like showering, putting on clothes. I was able to do all that solo. The only thing I really needed help with was laundry because that required me to reach up above my shoulders. Now, compared to bottom surgery, I would say that top was a little more doable and easier to recover from as well. But also, I had a really good surgeon who was very responsive in terms of addressing complications, making sure things were okay. Shout out to her for putting up with all my late night calls and emails. She's wonderful. I, of course, am really happy now. I feel like my quality of life has massively improved. To tell the truth, all the issues with insurance and billing were just taking a lot out of me. I didn't know if I would get the surgery for the next couple of years. I was getting denials or letters from my insurance office pretty much every other month. Denials across a variety of different providers, really. And looking into insurance and billing had become almost a part-time job, right? There was a time when I was spending, I want to say maybe 10, 15 hours a week, probably just, reading Medicaid handbooks, reading Aetna handbooks, reading state policy on gender affirming surgery. It was just taking up a lot of time, almost something that I don't want to say obsessing over, but, I was just so desperate for this surgery. I was so dysphoric, like, all the time. I remember I couldn't really go to class. I couldn't bring myself to get out of bed sometimes. There were times when I would shower and I would just cry because I, couldn't stand the sight of my chest. It was just really a lot, and it was all just exacerbated by this fear that, because of insurance and the denials, I could maybe never get this surgery for the next couple years. And so I am really grateful with what I have now. I'm really grateful that I was able to get this surgery, and I'm never going to take this for granted. It shouldn't be a privilege to be able to access healthcare, but the reality is I am very privileged to be able to live in a state that has such amazing surgeons, such amazing access to hospitals. I am very privileged to be on Medicaid, to have these surgeries covered by Medicaid, to live in a state that allows for that when so many other states have sort of revoked gender affirming care under Medicaid. It is something that I think about a lot, and I'm never going to take this for granted. Okay, on to bottom surgery because I do have a major update. So I finally gotten a date for the next stage of surgery, and that's going to be sometime at the beginning of August. Now, as some of you may know from my previous videos, I had bottom surgery, but my guy is a little high and needs to be lowered. So the lowering and some of the stuff with the urethra is going to be done in August. And I'm told that that's not going to be too terrible a recovery, maybe only 2 weeks, less than top surgery apparently, way less than the 3 months I was given for the phallus creation stage of phalloplasty. And so I'm really thrilled to hear about that. I'm very excited. To be honest, I'm very grateful that it is so soon in August. One of the things that I've been stressing about is that if I don't finish my transition by the time I graduate from college, I may have to delay pursuit of graduate education. I've always wanted to be a clinical psychologist and later go on into trans healthcare, but getting a PhD is a privilege. Traveling to live in a state that may not provide quality healthcare for trans people is a privilege. And so everything now is all about finishing my transition as fast as possible so I can move to a different state if I really, really need to complete a PhD. And yeah, so that's mostly it for surgery updates. I'm sure I forgot a lot of things, so if you have any questions, feel free to ask me below. I'm always open to responding. Thank you for watching, and I will see you later. Take care.